this video, I want to break down a premier hormonal assessment for cycling females, perimenopausal, and postmenopausal women. And this is a test from a company called Diagnostics, and it's a saliva test to check hormonal levels. And oftentimes, saliva testing is superior to blood tests in the sense that it can measure the free fraction and unbound hormones in the body, and therefore give more of an accurate assessment as to the levels of the hormones internally. And so this test will look at progesterone and estradiol levels, as well as DHEA and testosterone. And I like to order the expanded version, which also will include follicle stimulating hormone and luteinizing hormone. And so really the basis for ordering a test like this is to unravel why a lot of symptoms may be present. And some of those unwanted symptoms from hormonal imbalances can be things like heavy and irregular periods, endocrine disruptions like moodiness and irritability, acne, digestive issues, headaches, fertility issues, brain fog, fibroids, breast tenderness, endometriosis. All these types of things can occur from hormonal imbalances in the body. And by getting an assessment like this, we can figure out how to create and how to craft a therapeutic program to really start to balance out those hormones. And so we're going to look at things like the HPAO axis, which is the hypothalamus, pituitary, adrenal, and ovarian axis, to be able to bolster functionality of those different glands. And so let's transition here, and we're going to break down a sample report from a 31-year-old cycling female who got this diagnostics report. All right, guys, so we're going to break down this test from this 31-year-old female who had this test from Diagnostics, salivary test for assessing hormones in the body. And let's jump into it here. We can see up top we have different days of the month, and it maps out the estradiol and the progesterone levels. And we can see the cycle information here, length at 28 days, when it started, when it ended, different ranges here for the follicular phase and the luteal phase. So we know that from 0 to 14 days, that's the follicular phase. That's where estrogen dominates. And then the second half, from 14 to 28, is the luteal phase where progesterone dominates. And we can assess right here with this upregulation in the green. This is the estradiol surge. We want to make sure that is present. And then that in the second half, estradiol levels drop lower, progesterone comes higher, maintaining that corpus luteum for proper progesterone production. And then we also have the DHEA and the testosterone levels are evaluated here. On the expanded version, we have the follicle stimulating hormone and the luteinizing hormone that is also present that will be shown on this as well. So we come on down, we have a few more graphs that map out some of the different hormonal levels, progesterone, estradiol, interprets those. And then we come here and we see, so here is the follicle stimulating hormone. This is going to be released to help create a healthy and mature follicle. And so we make sure that that goes up right before that ovulatory time frame here. And then the luteinizing hormone over here, we have that surge of the luteinizing hormone right here. And we can see the patient values against the reference range and whether or not they're within that normal range or not. Breaks down a few more definitions of that. And so really, this is the basis of the sample report. It continues on into a few more categories here, the time elements, so we can see cycle length and timing right there, and then the individual hormones are mapped out here. It gives a breakdown as to whether or not those were in normal ranges or not, and then the balance as well. So I really like up here, this graph right off the bat kind of shows where we're at in the follicular and the luteal phase. And oftentimes when I interpret graphs like these, we can see graphs that look very much different from this. And then that can give me more insight as to whether or not we need to tackle more of the ovaries, the adrenals, or is it hypothalamus, pituitary. We'll check different glands and different organs in the body to see where we need to modulate healthy hormonal output. And this is a test that can give us really amazing insights as to what we need to hone in on, what we need to focus in on as far as modulating that hormonal output, balancing things out. And that's going to allow for a lot of the symptoms elucidated earlier in this video to be eradicated. And so we'll see a lot of the breast tenderness start to go away. moods start to stabilize, even PMS symptoms can dwindle. And so this is an amazing test to assess where those levels are at. And so I just wanted to give you guys a visual here as to what to expect if you were to get this diagnostics test on a cycling female and what some of the report would show and where the hormones would be at. So as you're watching this video, if you're someone who can relate to any of the symptoms mentioned, I think it's worth getting a female hormone profile to really assess more objectively the levels of the hormones internally and to therefore have a better therapeutic treatment plan to really balance out those hormones. And if this is something that interests you, I would love to lend a helping hand, and I would just encourage you to head over to my website, drshamus.com. Under the form section, there's an application you can fill out and submit to me at immunahealth@drshamus.com. When I get that in my inbox, I figure out a time that works best for us. We can jump on a phone call and discuss more in depth what's going on from the application and if this test specifically could be beneficial for you. Hope you guys enjoyed this video on me breaking down the diagnostics female hormone panel.